in the lymphatic watershed of the upper body. We do little outward circles with your fingertips, keeping in the space just above the collarbone, bounded by the base of the neck and the trapezius muscle. You can do it with 2 or 3 fingertips. And after we've done that for about a minute or so, you step onto the left of the client. Place your left palm on the forehead, just above the eyebrows, and just find the mastoid and just arrange your fingers on the right hand so that the middle finger sticks out a little bit. And then we're going to do a downward stroke from the mastoid all the way down the sternocleidomastoid muscle on the side of the neck, with all the flats of your fingers in contact with the neck. A few short strokes and a few long strokes. And then we repeat on the other side as we step to the right of the client. And again we identify the mastoid behind the ear, and we stick out the middle finger just a little bit and we go all the way down. And a few long strokes, short strokes. Most importantly, all the surfaces of the fingers in contact with the neck. On the side and slightly to the back. One side at a time. Otherwise it's too much for the muscles and the blood vessels in the neck. Only one side at a time. And always downwards. Then we go back to step 1 where we decongest as we've drained all the tissue fluids from the top half of the body and opened lymphatic and energy channels down the neck. Then we go back and we do step 1 again, which is removing congestion just above the collarbone. With your fingertips, the heels of your hand resting on the shoulders so that you're nice and comfortable, and very slowly and very lightly the client needs to feel the pacing down and to feel the relaxation which comes from the pacing down. Under the tips of your fingers you may feel tiny muscles, ridges from the platysmus muscle, and we just soothe it away and try and relax them as well. If there are any lumpy bumpies, little low lymph nodes, we go around the little lymph nodes. So step 1 is decongesting, step 2 is vacuuming, and now we are decongesting the space between the shoulder blades again. For the general treatment, we focus on the space just above the bra strap line, going all the way up to the 7th cervical vertebrae, and working on this entire zone. We place our palms on the back of the body, and with the thumbs we do tiny little circular rotating movements, going all the way up to the top of the chest. And then we fan our thumbs out in a V-shaped manner, going in between the shoulder blades beautifully, nicely relaxing everything. And imagine that you're bringing out deep inner muscle tension as it comes out. And the next step, after we've loosened everything up, is to drain it. And we are going to use something called a cupped caterpillar movement, which is very funny, but first let's imagine we're just a caterpillar going up with the closed cupped palms, first going straight up like a closed caterpillar, pushing all the energy into this triangle above the clavicle, the supraclavicular fossa. So we just do a few straight up caterpillar movements and then doing some drainage at the top. And the next part would be to do some rotating movements, cupping and draining. And after we've done both of those, we're going to put those two movements together in a cupped caterpillar. Draining upwards, making sure that there are no gaps in between the fingers because we want to keep a closed, sealed vacuum going up. And there's one more way of also vacuuming and draining it, is to do something called the leapfrog, which is a slightly different movement, where you have hands flat, palms flat, then you kind of slap your hands very gently, of course, and then you can hear the sucking movement as it goes like that. I can hear it, perfect. Just like a leapfrog. From the bottom all the way up to the top. We've done that a few times. And then we do the most important point of relaxing all the muscles between the shoulder blades. And to find that point, you go from the top of the shoulder blade to the bottom of the other one. And then I push myself back as much as I can. And exactly where the crisscross joins, I place my thumb horizontally in the space between the vertebrae. Then I ask the client to take a deep breath in, and as she breathes out, I do a quarter turn from the 9 o'clock position to the 12 o'clock position. Ask her to breathe again. All the time imagining that my thumb is drifting into the tissues, breathing in and out. And I hold it there till I get a feeling as if my thumb has actually sunk into that intervertebral space. Another breath in, taking all the time in the world to do it properly. And now I ask her to point her elbows back towards me. Both of them, just point them back. And then I grab the tips of the elbows, take a deep breath in. And this movement actually recenters that nerve back into the vertebral column. Having done that, I next bring the life force down, again with the flats of my palms, from the top of the thoracic area, 7th cervical vertebrae downwards, only as far down as the 5th lumbar vertebra, only up to the sacrum. We massage this area downwards because the sacrum has only got to be massaged upwards. And just to finish, we'll just quickly show you the way in which the sacrum has to be massaged. We dip our fingers all the way down to either side of the sacrum and the tailbone, the thumb horizontally, and we work up in a V-shaped manner along the sacroiliac joint. And this is rather beautiful because it decongests all these tissue fluids and sends them away. And I would just do a little bit of horizontal drainage just to decongest the joint even better. And partners can do this for their wives or for each other, because even men need a lot of relaxation if they've been sitting for long hours at desks and at computers. And this is the basis of setting up a good lymphatic flow in the whole of the back and a basic preparation for further treatments on the back.